So good evening, everyone. Welcome to today's Q&A session. Myself, Dr. Tanima Singhal, and I welcome you all on another session of Q&A. So you all can put your questions in the chat box. Till then, I'll take the questions which you have filled in the Google form. So first question is from Sravani, low milk supply. So for low milk supply, as I always say, you have to first work on creating more demand. If your baby is already coming on the breast, then you need to create that extra demand by doing the pumps. And if your baby is not at all coming on the breast, then obviously you have to pump. Second thing is maintaining your good hydration. Next is for improving the milk flow, do oil massage and warm compress. For galactococcus, take lactomagic powder and Morico tablets. Keep the baby skin to skin with you. And lastly, you have to track. So track your results by checking the baby's weight gain and checking the formula intake. Next question is from low milk supply again from Pushkarini. Okay. And then Kirtana want to know about pumping techniques. What do you want to know about it? Let me know about it. What do you want to know about pumping techniques? Dhanshri, bottle feeding to breastfeeding transition, latching issue. If you want to get your baby from bottle to breast, then you have to first make sure that the milk flow should be good from the breast, and also the bottle which you are using should not be a high flow bottle. So make sure when you turn the bottle upside down, the milk should not be dripping by itself. So in that way, with this bottle, first you have to train your baby for a slow flow, and you have to improve the flow on your breast so that the baby gets adjusted to the new flow, and the flow is good and the supply is good for you. Avjot, low milk supply, pain in the nipples. So pain in the nipples will always be because of shallow latch. So you have to work on your deep latching. Amrita, my baby is 4 months old and she's used to the bottle because of low milk supply. I have taken lactation supplements. Since 10 days, my milk quantity is same, though I pumping 6 times a day and formula milk quantity has not reduced. So always remember, if the formula milk quantity is not reducing, but at least it is maintaining and the weight gain is there, that means whatever amount, because your baby is growing also. So when the baby is growing, the baby's demand is increasing. So if the formula milk is not increasing, but the weight is increasing, that means you are on the correct path. You have just been, Amrita, you have just followed for 10 days. So right now your formula has not increased. That's a good thing because it's a growing baby. So just keep moving whatever you are doing, because at 4 months, the baby's demand is more. And if the formula milk is not increasing, then whatever amount of milk you are producing is stopping formula from increasing. It's a good sign. Keep moving, Amrita. Next question is from, so baby rejects breast 5 months. So what is the milk supply? What is the flow? Aarti, babies refusing breastfeeding. Hiral, low milk supply latching. Or for low milk supply, I have already answered. About latching, I have already explained things. So if I see any new questions, I'll give answer. Dia, latches fine, drinks for 20 minutes each side, looks satisfied after feeding. If falls asleep, long gap of 3 to 2 hours. If not within an hour, what to drink again? What does this mean? So this is called as a cluster feeding. It happens in 24 hours. If you ask, 3-4 hours, you will see the baby will be doing cluster feeding, which is very normal. Otherwise, the baby will sleep for 2 to 3 hours. But during this cluster feeding, the baby will be asking for frequent feeding, which is absolutely normal. Then most of the questions I see low milk supply. Then Sri Devi, my baby demands bottle feeding. How to change bottle feeding to breastfeeding? Is it possible for 5-month baby? I have just answered this question. Suraksha, facing issues with flat or inverted nipples, which is difficult for my baby to latch and suckle. So first of all, you don't need to worry about the flat or the inverted nipple. You have to make sure that the baby is latching through the areola. And all these are all related to low milk supply and baby like latching issues. I have already answered. Let me see if there are any questions in the chat box. Rima, is it normal for a 3-month-old baby to take only 60 ml per feed? So if the weight gain is good, then perfectly fine. The weight gain for a 3-month-old baby is 100 to 150 grams in a week. If the baby is gaining weight with that, so that means it is fine. Every baby is different. Every mother is different. Every baby's demand is different. If the baby is gaining weight properly, then you don't need to worry about the quantity of breast milk or the quantity of formula milk. This reminds me one more very important thing. Most of you are just worried about the quantity of breast milk. Always remember, every mother is different, every baby is different. The quantity of milk produced by one baby by one mother is very different from the quality of the composition of breast milk produced by the second mother. Same way, one baby of 3 month old will bring different milk, like different milk quantity than the 3 month old baby, second baby. So that's why please don't worry about the quantity of breast milk or quantity of formula milk. When you're working on your milk supply, and then when you start pumping, and when you get very less milk, please never get demotivated. You have to keep moving. Sometimes, because even 5 10 ml of breast milk is very high composition milk, very high quality milk. So if you are seeing that the formula milk is not increasing and the baby's weight is increasing, that means you're on the correct path. First 7 to 10 days, you will see these kind of results. If you keep moving, you will see the baby's formula will start coming down. So if the baby's formula is coming down, but your baby is gaining weight properly, that means you're going on a correct path. So never get confused about the quantity of breast milk. 60 ml of formula is not equivalent to 60 ml of breast milk, which most of you just do this mistake. When your baby is taking 90 ml or 120 ml of formula, you try to produce 90, 120 ml. It's not correct. You should never compare two amounts. Always the breast milk, the quantity is very different. Formula quantity is very different. You just need to track your baby's weight and keep tracking the baby's formula and keep moving. Always have trust and faith on yourself that you can definitely get the results. Don't just stop obsessing about the milk quantity, and that will help. Okay, so I don't see any new questions here. Is anybody writing any question? You can just let me know. Otherwise, we can just uh, wind off the session today, because I don't see any new questions. There are many people here, but I don't see anybody putting a question. Is anybody writing their question? Just let me know. Otherwise, we can stop the session. How to increase breast milk, Shravani? So I have already answered. Let me repeat it again. I think you have joined late, Shravani. So always first work on your demand. If your baby is feeding from the breast directly, then to create that extra demand, you have to pump. Now, all the breastfeeding mothers who are breastfeeding, and when I advise you to pump, the most commonly asked question is, "Ma'am, I don't get any milk with the pump. Then should I still pump?" Always remember, a mother who is already breastfeeding the baby. Our motive of pumping is not to get milk in the pump. We want the milk to be increased, which the baby should take. Why are we pumping then? We are pumping to give that extra stimulus to our brain to make more milk. So all the breastfeeding mothers who are pumping, and when you're not getting anything with the pump, please don't worry. We have to pump only to tell our brain to make more milk. So that way you are creating more demand with the pump. So now pumping is like different case. There are different case scenarios for the pumping. For a relactation mother, the pumping is to create the demand, and you will not get milk initially with the pump, but you will get milk with the hand expression. For a total breastfeeding mother, we aim to do pumping only to increase the milk supply by creating more demand. You will not get any milk with the pump, but if your baby's latch is shallow, then you might get. So if you're not getting milk with the pump after your direct feeding session, that means your baby's latch is good. The baby is able to empty the breast. So that's why please stop worrying about the quantity of breast milk when you cook. And also one common mistake which I see in mothers, they breastfeed the baby and then they check their milk by doing the pumps. They pump and they get only 20-30 ml, and then they start worrying, oh, my baby gets only 20-30 ml. So please always remember, all the breastfeeding mothers, your your brains are wired according to the baby's stimulus. So if you start pumping during that time, you might not get any milk, or you might get very less. So pump quantity of milk which you are getting is not the correct indicator of how much milk you are producing. So please never worry about how much milk you are pumping and how much the baby is getting. The baby will get more milk. If suppose you're pumping and you're getting less milk, please don't worry about it. The baby will be able to express the milk more. So the milk quantity in the breast is more than what you are pumping. Okay. Next question is from Rima. I have low milk supply and baby is refusing formula. What to do in this situation? Okay, so you can try what you can do if your milk supply is less and first of all, let me know, how do you feel that the milk supply is less? Is the baby gaining weight properly? If the baby is not taking formula, maybe that the baby is gaining weight properly, baby is already full and sufficed, the baby is crying for any other reason. Why are you only worried about the milk quantity, that my milk supply is low and the baby is crying? It may be that the baby is not needing milk. The baby is crying for any other reason. You need to first see the weight gain accordingly. Okay, baby is not gaining weight as you have mentioned. Okay, so for that, what we can do, if you have to give formula and the baby is not accepting formula this way, then you can follow the supplemental nursing system. In that, you have milk in a bottle and you take a infant feeding tube size A6 or 8 is very good. You just dip one part in that bottle and one part you place it on the breast. And when the baby suckles on the breast, the baby gets milk from the bottle also and from the breast also. So all the babies who are not accepting bottles or they don't like the taste of the formula, and if you have to give for some time because you have to gain the baby's weight and all that, then you can follow this method. Also, if your baby is not gaining weight with breast milk, then what you have to do after every breastfeeding session, see the color of the milk. If the color of the milk looks thick white, then you have to pump for 5-10 minutes and keep giving this milk to your child. Your baby will start gaining weight properly. So this all things you have to work, and also you have to work on your nutrition, on your water intake. Take galactogogues like Lactomagic powder and Morico tablets. That will help a lot. Okay. Okay, so that's all for today. I don't see any new questions. I hope the questions which you all wanted are answered. Okay, so that's all from my side. I hope your questions were answered and it was a helpful session. If you have any questions, you can join again next Friday and we'll be here. We'll answer your questions. So take care, everyone. Bye-bye. Good night.